In this section, we will look at enteral routes of administration and dosage forms that can be administered via these routes. In enteral routes of administration, the drug is delivered through the gastrointestinal tract, which starts from the mouth all the way to the anus. For example, the oral route, which means that the medicine is swallowed. The sublingual route, where the medication is placed under the tongue. The buccal route, where the medication is placed in the mouth between the cheek and the gums. And the rectal route, where the medication is inserted into the rectum. The oral route is the most commonly used route of administration due to its many advantages. It is convenient because it is easy to self-administer medications and it is painless. Medications are usually well absorbed because the gastrointestinal tract provides a large surface area for absorption. Oral medications are also cheap compared to most other parenteral routes, and the oral route is safer compared to injections. However, there are also some disadvantages to the oral route. Not all drugs are well absorbed. Some drugs experience high first-pass effect, which I will explain in a bit. Some drugs are destroyed by stomach acid and enzymes. It takes time for drugs to reach the gastrointestinal tract and get absorbed into the body. Therefore, the effect would be too slow in an emergency situation. Some drugs can irritate the stomach and cause nausea and vomiting. Some drugs also have a very unpleasant taste, and the oral route will not be suitable for patients who are unconscious or vomiting. If you were to design an oral formulation, you will need to know what the conditions are like in the gastrointestinal tract. The pH is most acidic in the stomach, followed by the small intestine, then the large intestine, which is slightly alkaline. So, if a drug is inactivated or destroyed by acid, then the drug may require a special coating to protect it until it gets into the intestines. Earlier I mentioned the first pass effect. Let's look at what happens when a drug is taken orally. After a drug is taken by mouth, it enters the gastrointestinal tract. The drug is then absorbed in the stomach and the small intestines. The drug is then brought to the liver before it enters the general circulation. The liver is our detox organ of the body and contains many enzymes. Some drugs are metabolized or broken down by the liver, so only a small amount manages to pass through the liver into the general circulation. So, before an orally administered drug can reach the general blood circulation, it has to first pass through the liver, and that's why it is called the first pass effect. Let's take a look at the dosage forms which can be administered orally, starting with solid dosage forms. We have powders and granules, tablets, and capsules. Let's start with powders. Powders contain dry mixtures of powdered medicinal as well as non-medicinal agents. It is one of the oldest dosage forms. A powder can be mixed with fruit juice, soft food, or water so that it is more easily swallowed. For example, some laxatives are available as powders. Some powders are meant to be reconstituted before they are dispensed. For example, some oral antibiotics are manufactured as powders. Then at the clinic or pharmacy, water is added before dispensing it to the patient. Powders are stable and have a long shelf life compared to liquid dosage forms. Because powders have a large surface area, they dissolve quickly. In comparison with a tablet would have to first disintegrate into small pieces before it can dissolve well. Large doses of drugs can be administered as a powder. For example, if the dose of a drug is 5 grams, it wouldn't be feasible to manufacture such a large tablet. A powder would be more appropriate. Powders are also easy to manufacture and are therefore more economical. However, there are also some disadvantages with powders. Powders are usually bulky and inconvenient to carry around. If the drug has an unpleasant taste, it will be difficult to mask the taste of the drug. Powders are also not suitable for potent drugs which require extremely low doses. This is because it will be difficult for the patient to accurately measure out the exact dose. Powders are also not suitable for drugs that are inactivated in the stomach, and they are not suitable for hygroscopic drugs. Hygroscopic means that the substance absorbs moisture from the air. You can think of those dehumidifier packs that you put in your cupboards. They absorb moisture from the air and become wet over time. So hygroscopic drugs would not be stable as powders. Powders are stable and have a long shelf life compared to liquid dosage forms. Powders have a large surface area, so they dissolve quickly. In comparison, a tablet will have to first disintegrate into smaller pieces before it can dissolve quickly. Large doses of drug can be administered as a powder. For example, if the dose of a drug is 5 grams, it wouldn't be feasible to manufacture such a large tablet. A powder would be more appropriate. Powders are also easy to manufacture and therefore more economical. However, there are also some disadvantages with powders. Powders are usually bulky and inconvenient to carry around. If the drug has an unpleasant taste, it would be difficult to mask the taste of the drug. Powders are also not suitable for potent drugs which require extremely low doses. This is because it will be difficult for the patient to accurately measure out the exact dose. Powders are also not suitable for drugs that are inactivated in the stomach, and they are not suitable for hygroscopic drugs. Hygroscopic means that the substance absorbs moisture from the air. You can think of those dehumidifier packs that you put in your cupboards. They would absorb moisture from the air and become wet over time. So hygroscopic drugs would not be stable as powders. Next, let's look at tablets, which are the most common dosage form. Tablets are manufactured by compressing granules or powders together. They contain the drug, which is called the active pharmaceutical ingredients, and many other additives, which are called excipients. For an oral drug to be absorbed, the drug needs to first dissolve in the gastrointestinal tract. Tablets have a small surface area, so they are usually designed to disintegrate into small fragments so that the effective surface area increases and therefore the drug can dissolve faster. The rate of disintegration of tablets depends on the excipients added as well as the manufacturing process. The disintegration rate of tablets is important because it affects the rate that the drug can be absorbed into the body. Not all tablets are the same. We have swallowable tablets, of which there are many different kinds, chewable tablets, effervescent tablets, lozenges, buccal and sublingual tablets. Tablets can be coated or uncoated. Tablet coatings may be added to prevent decomposition or minimize taste. Film-coated tablets are coated by a thin film of polymer. This film is usually colored. Sugar-coated tablets are not so common nowadays, but we still do see them sometimes. Enteric coating is a special type of coating that is meant to resist the acidic gastric fluids but release the active ingredients in the intestinal fluid. The tablets are coated with a layer of acid-resistant polymer. So in the stomach, where fluids are very acidic, the coating remains intact. When the tablet reaches the small intestines, where pH exceeds 6, the coating will dissolve and release the drug. Enteric coating is useful to protect drugs which degrade when exposed to acid. It is also useful to protect the stomach from drugs that may cause irritation, for example, aspirin. Some tablets are controlled release. This is indicated on the product name. For example, CR means controlled release, SR means sustained release, and LA means long-acting. Extended release tablets release the drug slowly in a predetermined manner over an extended time. This helps to reduce sudden fluctuations in the concentration of drug in the blood and therefore minimizes side effects caused by high blood levels of the drug. It also reduces dosing frequency. For example, a medication which is usually taken 3 times a day can be formulated to release the drug slowly so that it's only taken once or 2 times a day. A simpler regimen would then help to improve patient compliance in taking the medication regularly. Chewable tablets are sweet, flavored tablets which are meant to be chewed. We commonly see chewable tablets in multivitamin tablets for children and antacid tablets. Effervescent tablets are not meant to be swallowed. They are usually dissolved in a glass of water before administration. The ingredients react in the presence of water to release carbon dioxide, which will then help the tablet to disintegrate. Lozenges are shaped and flavored much like sweets. They are intended to be slowly dissolved in the mouth, usually for local effects. For example, lozenges are often used for cough and sore throat. Besides tablets that are meant to be swallowed, there are also sublingual and buccal tablets. Sublingual tablets are placed under the tongue and allowed to dissolve. Buccal tablets are meant to be placed between the cheek and the gums. For both sublingual and buccal tablets, the drug is absorbed directly into the blood. This is because the membranes lining the mouth are very thin, allowing the drug to pass through easily. And there are also many blood vessels under the tongue and on the inside of the cheek. An example of a sublingual tablet is nitroglycerin tablets, which are used for the treatment of angina or chest pain. When a patient has chest pain, the small nitroglycerin tablet is placed under the tongue where it is rapidly absorbed and can relieve the chest pain quickly. Compared to the oral route, the sublingual and buccal route allows a much faster absorption of the drug because it is absorbed directly through the mucous membrane. The sublingual and buccal routes also bypass the first pass effect because the drug does not have to go through the liver before getting into the blood. However, due to the small size of the oral cavity, these routes are only suitable to deliver small doses of potent drugs. It is also more challenging since the drug must be kept at the site and the patient should refrain from swallowing while the medication is in the mouth. Another solid dosage form that we commonly use is capsules. There are two types of capsules, hard and soft gelatin capsules. In hard gelatin capsules, the shell consists of two pieces, a body and a cap. Whereas in soft capsules, the shell is a single piece which is completely sealed and cannot be separated. Hard gelatin capsules are usually filled with solids such as powders, granules, pellets, or small tablets. Soft gelatin capsules are usually filled with liquids such as solutions or suspensions. The shell of soft gelatin capsules also contains a higher ratio of plasticizer to gelatin. Plasticizers make the shell more flexible. How does the rate of drug absorption from a capsule compare to drug absorption from a tablet? Let's see what happens in a capsule. When a capsule reaches the stomach, the capsule shell is disrupted by the water in the stomach contents. This releases the contents of the capsule. If the drug was filled into the capsule in a powder form, then the powdered drug can disperse rapidly and dissolve quickly. When the drug is dissolved, it can be absorbed into the body. Compared to a tablet, which has to disintegrate before the drug can dissolve, capsules can therefore provide a faster rate of drug absorption. Compared to tablets, capsules can provide better bioavailability in terms of faster absorption. Since the drug is covered by the capsule shell, it can also mask the taste of the drug. Capsules are also easier to swallow compared to tablets, and it also allows more flexibility in the formulation. For example, capsules could be filled with different systems such as beads, granules, small tablets, or powders. However, capsule filling is slower than tableting. Because of this, capsules are more expensive and slower to make than tablets. Now let's take a look at liquid dosage forms. We have solutions, suspensions, and emulsions. In solutions, the drug is completely dissolved in the solvent, which is usually water. It is a homogeneous one-phase product. Visually, you can see that the solutions are clear. Since the drug is already dissolved, the drug can be absorbed very quickly in the gastrointestinal tract. Two examples of oral solutions are syrups and elixirs. Syrups traditionally contain a concentrated sugar solution, but it can also be formulated with artificial sweeteners. Syrups are usually viscous and thick. Elixirs usually contain both water and alcohol. Alcohol is used to improve the solubility of the drug. Elixirs are usually less sweet and less viscous compared to syrups. In suspensions, solid drug particles are dispersed in a liquid vehicle, usually water. It is a two-phase system, a solid phase and a liquid phase. The solid drug particles will tend to settle over time. That's why you will always see the instruction to shake the bottle before use. Otherwise, the drug may not be uniformly distributed. In a well-formulated suspension, the solids should settle very slowly and should be easily redispersed when you shake the bottle. For the drug to be absorbed, the solid drug particles will first have to dissolve. How quickly the drug can dissolve will depend on the particle size. Fine particles will tend to dissolve faster than larger particles. Besides the oral route, suspensions can also be formulated for many other routes such as topical, which is applied on the skin, injectables, eye and ear drops, and vaccines. An emulsion consists of at least two immiscible liquid phases, oil and water. One liquid phase is dispersed as small droplets in the other liquid phase. We know that oil and water don't mix well, so emulsions are physically unstable and tend to separate into two distinct phases over time. An emulsifying agent is added to stabilize the emulsion. There are two main types of emulsions. Oil in water means that the oil is dispersed as small droplets in water. Oil in water emulsions are often used to deliver drugs that are oil or lipid soluble. They can be used for oral administration. Water in oil emulsions means that the water is dispersed as small droplets in oil. These are creams and lotions which are commonly applied onto the skin. Another enteric route of administration is the rectal route, where the dosage form is administered into the rectum. It can be used for a local effect, for example, to administer laxatives which work on the large intestine. It can also be used to administer drugs with systemic effect, for example, paracetamol, which is used for pain relief and fever. The rectum has blood vessels, and drugs can cross through the mucous membrane directly into the blood. Rectal dosage forms include suppositories, which are semi-solid dosage forms that are inserted into the rectum. Once inserted, they would melt, soften, or dissolve to release the drug. Ointments and creams can also be used, for example, steroid creams to treat inflammation. Enemas are liquids which are administered into the rectum. Most enemas are laxatives. However, diazepam, which is an anti-seizure medication, is also available as an enema. The rectal route is useful when patients have nausea and vomiting or are unconscious. The rectal route is also preferred for drugs that relieve constipation or drugs for hemorrhoids. However, the rectal route is not preferred by patients because it is inconvenient. The rectal absorption of most drugs is also frequently erratic and unpredictable. It may also be difficult to keep the suppository in place as it might leak out or be expelled after insertion. In this section, we have looked at enteral routes of administration and dosage forms that can be administered by these routes. In part 3, we will look at parenteral routes of administration.